Assalamu alaikum. Our lecture will be about hypersensitivity reaction. By the end of the lecture or two lectures, you will be able to define hypersensitivity and allergy, and you will be able to classify hypersensitivity reaction, and you will be able to describe the pathophysiology and immunology of each type of hypersensitivity reaction. Let us start by this definition. The hypersensitivity is exaggerated inappropriate immune response. So hypersensitivity is an immune response, but this immune response is exaggerated and it is inappropriate immune response. And the allergy is altered reactivity. That's to say, heightened reactivity of immune system to foreign substance. There is foreign substance, and this foreign substance is harmless. In allergy, there is altered reactivity to this harmless substance, and there is harmful or there is heightened reactivity to these foreign substance. So allergy is type of hypersensitivity reaction. Hypersensitivity reaction is broad term. It involves exaggerated and inappropriate immune response to self and non-self, okay, or foreign. But allergy is altered reactivity to harmless foreign substance, like egg, مثلا. We called it is allergen. They are the types of hypersensitivity. There are four types of hypersensitivity reaction, and this classified according to the basis or according to immunological mechanism that's responsible for tissue damage and the diseases. And these four types are type 1 hypersensitivity reaction, type 2 hypersensitivity reaction, we called it cytotoxic, and type 3 hypersensitivity reaction, we called it immune complex mediated, and type 4 hypersensitivity reaction, we called it cell mediated immunity or cell mediated hypersensitivity reaction. Type 1 hypersensitivity reaction or immediate hypersensitivity reaction. This type of hypersensitivity reaction is mediated by the IgE and the mast cell. And this IgE and mast cell is stimulated upon re-exposure to the antigen or allergen, and it secretes mediators that cause type 1 hypersensitivity reaction. So the first exposure to the allergen does not cause reaction or does not cause visible reaction or does not cause harmless, but upon second exposure it does cause. Let us know the atopy. Atopy is genetic predisposition to produce IgE antibodies against harmless environmental allergens. So when there is a person that genetically predisposed to produce reaction or to produce immune reaction or develop immune reaction against harmless antigen, we call this person is atopic. Okay, so atopy again is genetic predisposition to produce IgE antibodies against certain harmless environmental allergens like egg, as I said, like pollens, grass pollen, and mites, and certain foods. Okay, what is the mechanism of type 1 hypersensitivity reaction? In type 1 hypersensitivity reaction, the B lymphocyte is stimulated to produce IgE antibodies, and this stimulation is helped by the helper cell, CD4 cell, that secretes cytokines that stimulate the B lymphocyte to produce IgE antibodies. Okay, IgE antibodies will go and bind to the surface of the muscle via its receptor, and this receptor called Fc epsilon. Okay, and when the muscle bind, or the IgE bind to the muscle and or basophil, this muscle becomes sensitized. We call it sensitized cell. So when the allergen enter our body, the B lymphocyte is stimulated to produce IgE against this allergen, and this IgE will bound to the surface of the muscle and basophil, and the muscle become sensitized. Upon re-exposure or later exposure to the same allergen or to the same antigen, this allergen will bound to the IgE specific for it on the surface of the muscle, on the surface of the sensitized muscle, and cause activation of this muscle and basophil to release its granules. Okay, and these granules contain active mediators such as leukotrienes, prostaglandins, heparin, and histamine, and these mediators cause damage to surrounding tissues. Okay, so in this picture, this is the allergen in the left. The allergen bound to the B lymphocyte, and the B lymphocyte activated to produce IgE, and this IgE will bound to the muscle, and the muscle becomes sensitized. On the second exposure of allergen, the allergen will cross react or bind to the IgE, and this causes activation of the muscle to release its granules that contain the active mediators. This is the muscle, and the green one is the IgE, and this is the this is the allergen or antigen. The muscle is activated and releases its granules. And the principal effect of these products cause vasodilation and smooth muscle contraction. Here in this picture, this is the first exposure to pollen, to grass pollen. Okay, then as you know that when the antigen or the foreign enter the body, this antigen will be taken by antigen presenting cell. The antigen presenting cell will take the allergen, let us say it allergen, will take allergen, and it presents this antigen or allergen to the T cell, the helper cell, and this helper cell will secrete cytokines that activate the B lymphocyte, and also the B lymphocyte bind to the antigen or to the allergen. The helper cell secretes cytokines that activate the B lymphocyte to produce IgE, and this IgE will bound to the muscle, and the muscle become sensitized. Okay, type. What are the reactions of type 1 hypersensitivity? The reactions occur in two phases: immediate phase and late phase. And this immediate phase is mediated by the mediators or that found on the granules of the muscle. Okay, and this immediate phase occurs within minutes after re-exposure to the same allergen, and it includes release of muscle granules, and these granules contain histamine, protease, and other mediators like prostaglandin, leukotrienes, heparin, and tryptase. Okay, and the action of these mediators, it causes increase smooth muscle contraction. Okay, and when there is a smooth muscle contraction, there is peripheral vasodilation, increased vascular permeability, there is bronchospasm, there is abdominal cramping. And when this reaction is systemic, it may cause hypovolemia and hypoxia. Okay, also extravasation of capillary blood and edema occur, redness in the skin, and there is shifting of fluid into in the interstitial space, and edema, pulmonary edema, and also there is pruritus, which is itch skin. Okay, طيب. In the late phase reaction, this occur after 4 to 24 hours after exposure, and this include the release of cytokines from muscle, and these cytokines from muscle cause chemotaxis and recruitment of other WBCs or other leukocytes like neutrophils and eosinophils, and these neutrophils and eosinophils cause inflammation, and this is the late phase reaction of type 1 hypersensitivity reaction. So again, the reaction of type 1 hypersensitivity reaction are two phases. Phase 1 is mediated by the granules of the muscle, or the content of the granules of the muscle, release of these granules. Okay, and this cause smooth muscle constriction, cause vasodilation, blah blah blah. And the late phase occur, and the late phase occur after 4 to 24 hours, and these result from cytokine that release from muscle. These cytokines cause chemotaxis and recruitment of neutrophils, eosinophils, and other type of blood cell that cause local inflammation and tissue damage. Okay, if you look to this picture here, the B cell act as antigen presenting cell. It present the antigen to the helper cell, and the helper cell secrete cytokines that activate P lymphocyte to produce the IgE, and the IgE will bound to the muscle, and the muscle become sensitized. Upon second exposure to the same antigen or to the same allergen, the muscle will activate it and release its granules. Okay, and these granules contain histamine, leukotrienes, and cause acute phase reaction. And in the early phase reaction is caused by neutrophils, eosinophils, and other WBCs that cause inflammation. And these are some examples of allergic diseases: asthma, allergic rhinitis or hay fever, refer to the nose; allergic conjunctivitis, the conjunctiva of the eye; and eczema of the skin; urticaria also occur in the skin; and anaphylaxis, it's a systemic disease; and food allergies and drug reactions. These are some examples of allergic diseases. The clinical findings of the allergy, the main symptoms, the clinical findings depend on the organ or tissue which involved. And the main symptoms is pruritus when involved the skin, and edema, rash, and rhinitis when involved the nose, and bronchospasm in the asthma, and abdominal cramping in food allergy, and there is a specific manifestation like allergic conjunctivitis, rhinitis, and asthma, as I said. Type. Okay, urticaria or hives is well circumscribed, have a boundaries like زي قرصة النملة, like ant type. It is raised periodic, itchy, and erythematous plaque, okay, with oval or round shape, several centimeters in diameter, form wheel, like wheel, and it is caused by muscle activation in the superficial terms. Okay, so urticaria well circumscribed, raised, periodic, erythematous plaque. Okay, have several centimeters. It formed the wheels, and it caused by muscle activation in the superficial depths. And angioedema is due to muscle activation in the derms or subcutaneous tissues. Okay, so the angioedema occur in the mucous membranes. This is the urticaria. This is raised, well circumscribed, several plaque, several centimeters. Okay, this is the urticaria, and this is the angioedema. Okay, it is in the mucous membrane. We called it angioedema in the mucous membrane. Okay, anaphylaxis or anaphylactic shock is the most severe form of type 1 hypersensitivity reaction, which is an acute systemic reaction that can be fatal. Anaphylaxis is one of the medical emergency. It is emergency condition, okay, and it can be fatal if untreated urgently, okay, and it is systemic disease. Diagnosis of allergy is depend on history. Okay, history to know to diagnose the disease, and history to know the offending or the causative agent of these anaphylaxis or these allergy. Okay, and then examination, and on examination you may find nothing. The patient comes to you after his symptoms resolve and there is no sign. Okay, and we can use the skin prick test. Okay, when it is positive there is wheal, and the skin prick test is introduction of certain allergen. Like here in this picture we introduce certain allergen into skin, and if there is allergy or the body is sensitized to this allergen, there is wheal. The patient develop wheal, like in this picture this is wheal. So when there is wheal, we call this is positive skin prick test for so and so and so for certain allergens. Okay, so the diagnosis by history history and examination, and we can do skin prick test. So we can measure also the total level or the IgE antibodies. We can measure the level of IgE antibodies, total level of IgE antibodies, and we can measure allergen specific IgE antibodies. In measurement of allergen specific IgE antibodies, we we measure the IgE that is specific to certain allergen, like let us egg. We measure IgE that is specific to egg. If it is high, so this patient have sensitivity or allergic to egg. Okay, and also we measure tryptase in serum, and this tryptase is a specific marker of mast cell activation, and when there is, it is raised immediately after reaction occur. And this tryptase, if it is elevated or increased, there is increased risk of severe reaction. There is increased risk of severe reaction. Upon of treatment of type 1 hypersensitivity reaction depends on the etiology of reaction. Okay, so from the history we try to know what is the causative agent or what is the offending agent that caused this allergy, and the mainstay of treatment is avoidance the offending agent if known, and then we can give the patient antihistamine or H1 receptor blocker, okay, like cetirizine or loratadine, and we can give the patient glucocorticoids or steroids, and we can give the patient epinephrine in case of anaphylaxis. In case of anaphylaxis, there is epinephrine or there is type of epinephrine, or there is epinephrine formulated in the pen. We call this pen EpiPen. Okay, and this the patient hold and carry this pen with him. When he feels that he will go into anaphylaxis, he would inject himself directly before arrive to the hospital or to be taken to the hospital. And allergy immunotherapy or desensitization, we can do some manipulation or immunological manipulation to desensitize this patient, to make this patient um, have less sensitivity or have no sensitivity to certain allergens. Okay. Do you have any question?